My name is Denise Bruen, and I'm an adult nurse practitioner. I specialize in multiple sclerosis. I have worked at the James Q. Miller MS Center at the University of Virginia since 2010. Today, I am presenting on behalf of my co-authors this presentation entitled The International Registry Tracking Pregnancy Outcomes in Women Treated with Dimethyl Fumarate. Although it is not recommended to use DMTs during pregnancy, many women are not aware of being pregnant until well into their first trimester. This registry was hoping to capture the data for women not realizing they were pregnant while still taking Tecfidera. The goal was to have an international observational registry with 310 to 375 patients. The study design was to follow pregnant women with MS who had been exposed to DMF any time from their last menstrual cycle up to or during pregnancy. Endpoints were looking at live births, both premature and full term, pregnancy loss, ectopic or molar pregnancies, birth defects, fetal death, or maternal death. Any birth defects were adjudicated by an external teratology expert. 263 women enrolled in the study from 8 different countries. 57 of them were from the United States, so roughly 20% of the overall registry. On average, they were 32 years old, they worked full-time, and most had exposure of DMF during their first trimester. At the time of this publication, 214 pregnancies were known of the outcome. Overall, from all countries, 92% of these pregnancies resulted in live births, with 8% fetal loss. Specifically looking at the United States, 89% resulted in live births, with 11% fetal loss. This is lower than the United States average of pregnancies ending in fetal loss of 12 to 16%. Of the pregnancies that have been reported, the majority were full term and of average gestational size. In both groups, there were no therapeutic pregnancy terminations done. There were no ectopic pregnancies. There was one stillbirth outside of the U.S. There were no maternal deaths or infant deaths. In the United States group, there was one known birth defect, which was a ventricular septal defect. In all countries combined, there were 7 known birth defects, with 2 being ventricular septal defects. The other 5 were of various other organ systems, not showing any sort of trend in terms of organogenesis. The 8 countries that were involved in this registry were Australia, Canada, Germany, Ireland, Italy, Spain, United Kingdom, and the United States. This lists the lead investigator and the center name where the information was obtained. In conclusion, although this is a small number of women that were tracked, there does not appear to be any safety signal if DMF exposure occurs in relation to pregnancy. Miscarriage seen was less than the U.S. average, and birth defects were very similar to the general population. We would love to have more patients in the United States registered in this, as there were just a small percentage from the United States.